Incretin Physiology GLP-1 and GIP. Incretins are gut-derived hormones released after food intake that enhance insulin secretion and help regulate blood glucose. There are two main incretin hormones. The first hormone is GLP-1, which stands for Glucagon-like peptide 1. It is released from intestinal L cells after a meal. These cells are mainly located in the distal small intestine and colon. When nutrients enter the gut, GLP-1 is secreted into the bloodstream and helps enhance insulin secretion in a glucose-dependent manner. The second major incretin hormone is GIP, or glucose-dependent insulinotropic peptide. It is released from intestinal K cells after a meal, primarily from the proximal small intestine. Like GLP-1, GIP stimulates insulin release when blood glucose levels rise. An important point to remember is that both hormones are secreted from intestinal cells in response to nutrient ingestion. They then act on the pancreas to modulate glucose homeostasis, helping the body maintain normal blood glucose levels after eating. Actions of incretins. First, incretins stimulate insulin secretion. They increase glucose-dependent insulin secretion from pancreatic beta cells. The term glucose-dependent is important because insulin release is enhanced only when blood glucose levels are elevated, reducing the risk of hypoglycemia. Second, incretins suppress glucagon by inhibiting glucagon secretion from pancreatic alpha cells. Since glucagon normally increases hepatic glucose production, its suppression helps lower blood glucose levels after meals. Third, incretins delay gastric emptying. By slowing the movement of food from the stomach into the intestine, they reduce the postprandial glucose rise, leading to smoother glucose control. Finally, incretins increase satiety. They promote a feeling of fullness and reduce overall food intake, which can contribute to weight reduction. The incretin effect. One of the most important concepts in incretin physiology is the incretin effect. Notice the comparison between oral glucose and intravenous glucose. When the same amount of glucose is given orally, the body produces higher insulin secretion. In contrast, intravenous glucose produces lower insulin secretion without the incretin effect. Why does this happen? When glucose enters the gastrointestinal tract, it causes the release of incretin hormones from the gut, which stimulate additional insulin release. As a result, after oral glucose intake, insulin secretion becomes significantly greater than after intravenous glucose administration, because incretin hormones stimulate additional insulin release from the gut. This enhanced insulin response to oral glucose is known as the incretin effect. In summary, the incretin effect refers to the amplified insulin response seen after oral glucose due to the action of incretin hormones released from the gut. Clinical significance. Understanding incretin physiology is important because it has become a major target for antidiabetic drug therapy, especially in type 2 diabetes mellitus. The first important drug group is GLP-1 receptor agonists. These drugs mimic GLP-1 action and reproduce many of the natural effects of incretin hormones. They stimulate insulin secretion, suppress glucagon, delay gastric emptying, and reduce appetite. As a result, they not only improve glycemic control but also promote weight loss, making them highly valuable in patients with obesity and type 2 diabetes. The second group is DPP-4 inhibitors. These drugs work differently. They block the enzyme DPP-4, which normally degrades GLP-1. By preventing GLP-1 breakdown, they prolong incretin activity and enhance the body's natural incretin response. Incretin physiology at a glance. Let's summarize incretin physiology by following the sequence shown in this flow diagram. The process begins with food intake. When nutrients, especially carbohydrates and fats, enter the gastrointestinal tract after a meal, specialized intestinal cells are stimulated. This triggers incretin release, primarily the secretion of GLP-1 from L cells and GIP from K cells. These hormones enter the bloodstream and act as messengers between the gut and the pancreas. The next step is the pancreatic response. Incretins enhance glucose-dependent insulin secretion from pancreatic beta cells and reduce glucagon secretion from alpha cells. This coordinated response helps the body handle the incoming glucose load efficiently. Finally, these actions lead to glucose regulation. Blood glucose levels are maintained within a normal range. Postprandial glucose excursions are reduced, and overall glucose homeostasis is improved. Key takeaways. First, remember the two key hormones, GLP-1 and GIP. Both are released from the gut after meals and play an essential role in regulating blood glucose levels. Second, these hormones produce four core actions. They stimulate insulin secretion, suppress glucagon release, delay gastric emptying, and increase satiety. Together, these effects help improve postprandial glucose control. Third, understand the incretin effect. When glucose is taken orally, insulin secretion is greater than with intravenous glucose because incretin hormones are released from the gastrointestinal tract. Finally, the incretin system serves as an important drug target. GLP-1 receptor agonist and DPP-4 inhibitors exploit this physiological pathway for effective diabetes management.